yet have a quorum, so we're going to start off as a subcommittee. First appointee, Senator, is Nicole Barrett for the Child Abuse and Neglect Review Board. Senator Crawford, whenever you're ready.
Good morning. For the record, Sandy Crawford, District 28. It's my pleasure this morning to present to you Nicole Barrett for the Child Abuse and Neglect Review Board. I'm sure you've all seen her resume. She is well qualified. She has over 20 years in family law, which I think is really important. Currently serves as the Chief Juvenile Officer for the 28th Judicial Circuit. She's a former GAL. And she just has a varied background that I think will be a great asset to serve on this committee.
Any questions for the witness? Seeing none. Thanks for your willingness to serve.
All right. Thank you very much. I appreciate it.
Oh, sorry. Senator Mosley, do you have a question?
Hello.
Hello.
Just a general question. So, children that have been sexually abused by a parent, normally those parents are not allowed out of prison until the child turns 18. Mm-hmm. And a lot of times those same children are still in the household. What do you feel about the parent being allowed to go back even though the child is 18? They're still not an adult and able to take care of themselves. And there are some children that don't want to have anything to do with that parent.
Well, I think that's a difficult question to answer because each case, obviously, factually, is on a case-by-case basis. I've been an advocate for, protecting children who are victims of sexual abuse. I believe that those children should be protected from the perpetrators at all times. As far as my capacity on the Child Abuse and Neglect Review Board, unfortunately, my opinion on that isn't that it terminates once they become adults. I will only be reviewing cases that involve minors. I think that the legislature, probably needs to address any concerns that they have about those laws, because I do have a legal background in that. But, as far as how that would affect my opinion in evaluating these cases, I can't really weigh in on that. I mean, I think my role is going to be looking at transparency, accountability, looking at problems with the system when I am reviewing these cases that involve sexual abuse of minors. So I think that is a very important role that I am happy to serve, and I hope I get the opportunity to do that.
Follow up. They also a lot of times tell the parent that they can't reach out to those minors, while they're in prison as well, but there's nobody really monitoring that either. Mm-hmm. So what are your thoughts on that?
Well, I think that, again, on a factual basis, case by case, I mean, it can vary. I think it is concerning anytime you have a perpetrator reaching out to a victim. I think that they try very hard to monitor that, and it should be monitored. Again, psychologically, sexual abuse is a very, very intimidating, tight web of, intimidation and psychology. And so I think that there is concern anytime that you have a perpetrator reaching out to a victim. But again, as far as my role on the Child Abuse and Neglect Review Board, it would be my job to evaluate in that factual basis whether that has occurred and whether that was a concern in a finding of preponderance of the evidence.
Any further questions for the witness? Seeing none, thank you for your willingness to serve.
Thank you very much. I appreciate your time.
And we are, before the next nominee, going to go ahead and establish a quorum. Mr. Secretary, please call the roll.
Senators O'Laughlin, Luetkemeyer,
Here.
Bean,
Here.
Beck, Here. Bratton, Brown, Berger, Here. Moon, Here. Mosley, Here. Roberts, Williams.
You have it? We do have a quorum. Next up is going to be Belinda Farrington, nominee for the Lincoln University Board of Curators. Senator Schnelting, whenever you're ready.
Thank you, Mr. Chair, members of the committee. Just wanted to come before you and present Belinda Farrington, a constituent of mine, a resident of Missouri for the last 42 years, and someone who's well qualified for the position to be on the Lincoln University Board of Curators. I won't go over her resume. She can answer questions about that, and I know you have that in front of you. The thing that stuck out to me the most, and what really made me excited about supporting her nomination, is the fact that we connected on this one thing. Students should be prepared for the workplace when they come out of our universities. One of the things that is important to me, and these are my words, not hers, but many of our students graduate with worthless degrees and with skills that they don't really know how to put into practice in real life, in the workplace. And one of the things that she wants to do is ensure that our students are well equipped, well prepared to face the workforce and the workplace as soon as they're out. So I present her to you, and couldn't be more excited about her appointment.
Any questions for this nominee? Senator Moon.
Thank you, Mr. Chairman. Thank you for being willing to serve on this committee. It interested me when the supervising senator or sponsoring senator mentioned that you really have a desire to ensure that what students are learning are applicable to their lives.
Yes.
And that brings me to a topic that I've heard somewhat throughout my tenure here, and that is that there tends to be a lot of remediation necessary between high school and the beginning of college. Is that something you noticed as well, and what might you see as a way to make some changes that would enhance students as they transition from high school to college and be more successful?
That's a great question, Senator. Actually, that's one of the visions and goals that I've always had, is that there's a disconnect between college and also high school. I think some of the problems occur early on, possibly even as early as elementary school, but I do think the curriculum needs to be aligned with college courses. I think that oftentimes there's no alignment, and I also think that happens once we have individuals that graduate and actually go out into our industry as well. I think there needs to be kind of a stakeholder aspect of that process where we have the connectivity of understanding what a student needs to be prepared for. High school often, and I'll just say this from a corporation perspective, we invested a lot of money when I was at Barnes Jewish Hospital because a lot of students didn't have the actual academic resources that they needed, and so we spent a lot of investment and time creating career ladders. We also created remedial programs, and also workplace literacy type programs in place so that we could kind of bridge that gap. And so I agree with you that a lot more needs to be done on what we call workforce readiness, and I think it needs to start as early as high school.
I like your line of thinking. I was thinking of at least two schools in the 29th Senate District in Ozark and Nixa, and they have some, I think, model programs, and I hope you'll have time to come down and visit and see firsthand what they're doing, because I believe that not just streamlines, but it allows the students to at least experience some things and may whet their appetite for future careers. So
Absolutely.
hope you can make a trip down to Christian County sometime and see those firsthand.
I'll follow up with you on that. Thank you.
I wish you well.
Thank you.
Senator Williams.
Good morning.
Good morning.
One, I just wanted to say thank you for your willingness to serve.
Thank you.
We know Lincoln University is one of two historically black colleges and universities in the state. You know, I'm very much interested to just kind of hear how your experience has been so far on the board. It's an institution I think highly of, and it's very supportive too. Clearly in St. Louis, there's a lot of distinguished alumni who's very engaged and excited about the future of Lincoln. What are your thoughts since you've been on the board? Just kind of some things you've noticed and maybe some things that you think is going to be a priority for you to help the university move forward.
A couple of things, Senator, would be one is, for instance, is getting former alumnus to be more engaged. You and I are probably from the same location, St. Louis, just the educational level of us reinvesting. I'm probably guilty of it as well. You know, we haven't always paid attention to the issues related to the survival of Lincoln University as well as Harris Stowe, and I do think that as alumnus, we have some obligation and responsibility to not only give back our talents, but to help work on different ways to support them financially. A lot of us have been blessed to have great careers because of the school, and I don't want to ever take that for granted. And so whatever connections I have as it relates to resources, not always monetary, but putting those connections in place, especially with the places that we've all been blessed to have jobs. So I think we're in a good place at Lincoln. I can say that for a fact. I think we are starting to align more into what the vision of our school will be and the legacy, and that's what I hope to present to you all as a member of the Board of Curators.
Yeah, thank you for that, and I look forward to keeping in touch.
Thank you. I would too. Thanks.
Any other questions? Seeing none, thank you for being willing to serve. Thank you, Senator.
Thank you, Madam Chair.
Next up, we have Ryan Kruger, who has been appointed to the Drug Utilization Board, sponsored by Senator Hough.
Madam Chair, members of the committee, Senator Lincoln Hough with you this morning to offer my endorsement and sponsorship of Ryan Kruger for the Drug Utilization Board, which he has a unique set of skills, I think, that lead him to be a good applicant for this and a good servant in this role. Currently serving as the, I think, pharmacy CEO, essentially, of our FQHC in Springfield, Jordan Valley Health Clinics, which I think serves roughly I'm going to say the southern half of the state of Missouri, in a constantly growing environment. Prior to that was the Director of Pharmacy and Retail Operations for, 8 or 9 years for a little retailer called Walgreens, which if anybody's filled a prescription there, I think you know probably how busy those environments can be. So with that, I'm not going to belabor the point. I'm sure if the members of the committee have any questions for me, I'm happy to answer them, or for Ryan, but I think he would be a good fit, and I appreciate the time from the committee this morning.
All right, thank you. Any questions? We're all for you.
Thanks, committee.
You. Next up, Casey Burton, sponsored by Senator Brown. Sorry, couldn't say that.
Morning, Madam Chair, members of the committee. For the record, Senator Justin Brown representing the 16th District. I am here this morning to present Dr. Casey Burton for the State Board of Health and Senior Services. Dr. Burton is from, excuse me, my home county of Phelps County. He works for Phelps Health as Executive Director in Research Government Affairs. I'm sure probably many of you have I've seen Dr. Burton in the building before. He's got a long list of accomplishments. I won't go into all of them. I'll leave that up to you for questions if you have for Dr. Burton. But he will be I think he will be a good asset to the State Board of Health and Senior Services. With that, we will accept any questions.
All right. Thank you for that. Anyone have any questions? We're a very non-curious bunch of people. Senator Beck.
Yes. So I have a question. So what would you consider the biggest issue or coming forward for DHSS?
Yeah.
What do you think is the biggest, besides money? I guess money would probably be part of it, but.
Yeah, no, and good morning, Senator. Thank you for the question. It's a great question. You know, since joining the board, I've had one official board meeting now. I've been so impressed by the sheer volume of services provided by DHSS. I thought before joining the board I had a pretty good familiarity with the department, but golly, we have 630 services we provide, give or take, touching on a number of issues. So yeah, I mean, obviously there's some budgetary constraints as we enter into FY 27 and 28. But going back to the core mission of the department, which is to promote health and safety for all Missourians, that's through prevention, collaboration, education, innovation, and response. There's a lot of areas where we can improve upon. I think a big issue for me, for back home in the 16th Senate District, and Senator, I'm not sure about your district, but health literacy is a big issue for us. And getting back to the budgetary comments, when we want to look at improving the health of all Missourians as well as the safety, looking for a cost-effective way to do so, I mean, health education is a key component of that. The department has really stepped up its game, I think, over the past 5-6 years in that area, and I'm excited by Director Wilson's plan to engage that further. But yeah, I see that as a key area where we can really impact, the health and safety of Missourians.
All right. Well, thank you. I appreciate it.
What'd you think about the restrictions during the COVID era?
No, that's a great question. In looking forward to, the present and the future, I like to look back to the past for lessons learned. That was an interesting time for the state of Missouri as well as for the department. And, again, going back to that core mission of promoting the health and safety of all Missourians, there were lessons learned. I think there were things we did well during the
What were those?
Well, responding quickly with the best available information at the time and continually monitoring for that. I mean, God forbid we have another pandemic, in the next several years. We can take the lessons learned of, how do we quickly assess what information is available to us, evaluate that, and try to make the best possible decision to, again, benefit the health and safety of all Missourians. And I think, my background with scientific expertise in public health and clinical research in particular would help provide some additional expertise to this board. So as you've seen, my background, I've stood up a clinical research program at our county hospital down in Phelps County. So again, kind of going back to the previous comment to Senator Beck, it's how do we assess information and promote that education for all Missourians? I'm not sure if that directly answers your question, but
I'm not sure if it does either, but I mean, it's a difficult question.
Fair enough.
And it was a difficult time. I think that the effects of trying to lock down our entire country and really doing so in a lot of places has just about destroyed our economic prosperity, and trying to rebuild that. We're small business owners, so the idea that, and at the time the department, really didn't issue you have to stay at home kind of order, which I would never obey, like never. But a lot of people did, and I would not want to see that ever happen again. Mm-hmm. So I would think that there would have to be some discussion about, when would that ever be appropriate? Do you feel that way?
It's an interesting question given, the function of this board. This board functions primarily, really exclusively as an advisory capacity to the department.
So you don't really have authority?
We don't really have any authority. I mean, of course, the department itself, its statutory authority to promulgate rules and regulations is ultimately derived from you all here in the legislature. They fill in the finer details on the process and implementation. But I think really to the heart of your question, for policy questions of public significance such as that. I mean, just as a taxpaying Missourian, I would prefer my elected officials, you all, or the people directly, if that may be the case, to make those sorts of decisions rather than a small handful of appointed officials. But
So we're going to be, we're looking for ways to try to do things more effectively and efficiently. Is there anything that you know of at that department that we could either do without or we could combine with another department?
no, it's a difficult question. Again, just given the sheer scope of services.
600, did you say?
I think it was 630 is what I was
I
saying.
need
give
a
or
list
take.
of that. I can't even think of 600 things.
Yeah, I mean, it is across the board from, lead testing to, newborn screenings to, the WIC services to you name it. And I'm still getting acquainted with all of those services myself. There's a lot to sink your teeth into.
All right, I'm going to take the pressure off now. Anyone else have any questions? Seeing none, thank you for your
Thank you.
willingness to serve.
Thank you.
Next, David Scott and Senator McCreery. He is appointed to the Elevator Safety Board. Oh, that's terrible.
Good morning. I am State Senator Tracy McCreery. It is my honor to be here this morning to support David Scott for the Elevator Safety Board. I think that my constituent is probably a little bit overqualified for this committee, if truth be told. He has a lifetime of experience in the elevator industry in several different occupations and titles and that kind of thing. The importance of this board shouldn't be dismissed. It's not uncommon to see in the news where terrible accidents happen in elevators, elevator shafts, that kind of thing. So this is about making sure that we're doing everything we can to keep Missourians safe. It includes, our constituents, but it's also about worker safety as well. So with that, we're happy to take questions.
So the last elevator guy we had, I said, be sure to work on the elevator on the right. I don't know. Because we've had staff get stuck in there. Does it, Senator Moon?
Good morning, Mr. Scott.
Good morning, Mr. Mayor.
As I was looking at your summary of your profession, it looks like on page 3 your business had lots of ups and downs. And so,
Well, there is left and right. We do have moving walks and escalators as well.
Oh, okay, good to know.
Yeah, very good. Yeah, well.
Thank you, Senator.
Tell me, what is, since Senator O'Loughlin mentioned the elevators and some of the problems we have, what is the biggest thing that causes failure in elevators?
Door problems.
Doors?
Doors.
Yeah, okay.
Yeah, doors take abuse, and there's several different mechanisms to make sure that the doors are closed, locked, and safe to take off. So when people hit doors, it causes problems, and locks don't make, and you'll sit there with the doors open. The car's never going to go because there's three safety features on the doors to make sure that it's ready to take off and go.
Yeah. And when you watch some of these action films, the access up to the top of the elevator isn't always present. So why is that?
It is there. There's
hidden pretty
there's
well.
a canopy that comes down. It's a lowered ceiling, and those are always locked.
Gotcha.
So,
okay, good. Thank you.
You're welcome. Thank you.
Senator Williams.
Thank you. How are you,
Senator
Mr.
Williams.
Scott?
Good. And you?
Hey, I had a question that was probably, relevant to the board, but more to your profession. What are you seeing in terms of individuals seeking careers, working within the industry?
So we're kind of unique, Senator Williams, we only open up our applications for our apprenticeship every 2 to 3 years. It's typically 2 years, but The DOL does allow us to extend that if we haven't been moving through the list. We are, as an industry, we're highly compensated, highly skilled workers.
Yeah.
So we do have a large pool of applicants that try to reach out to us. I've had people call me this morning trying to get on the list. It's every day people are trying to get in. It's just, for Local 3 in St. Louis, there's 377 of us.
Absolutely.
And that goes from Indiana, Kentucky, Illinois, and then the middle part of Missouri. So there's a lot of people voting for a few jobs. So.
Yeah, because the individuals I know in the industry, they love it. And
Yeah.
I was just interested and curious. I'm kind of on this focus of how do we look at alternative options for those who may not want to or have the desire to go to a four-year institution to be able to go into the trade. So I was just curious, but most people I know in the profession love it, so it makes sense.
Well, you were a panelist last week at the construction forum,
Yeah.
correct? And I was there in the audience, and they're doing a lot of work trying to get interest in the trades for young people. So hopefully that's a bridge.
Yeah, and good to see you again, and thanks
Good
for
to
being
see
here.
you. Thank you.
Anyone else have a question or comment? Remember what I said if you're here.
I'll give you my card. You can call me.
All right, thank you.
Thank you for your time.
Thanks for being willing to serve. We might as well. Next up is Carrie Hruza, who is appointed to the State Board of Optometry.
Yep, photo. Yeah, of course.
Good morning. Thank you for allowing me to talk about how amazing one of my constituents is, Dr. Carrie Hruza. We knew each other just as neighbors before all of this got going. She has had some of the most amazing dogs that I've ever seen in my life, and she is, her dogs are beyond spoiled, so I think Senator Luetkemeyer could understand where you're coming from on that. So Dr. Hruza wants to be reappointed actually to the State Board of Optometry. I know that we're sort of treating this like a new one, but she did serve on the board before. I think she is an excellent addition to this board because throughout her professional career, she's held a lot of different roles, including at the retail level, but also as a technician and things like that. And she does charitable work as well in the community. So I think Dr. Hruza would be a great addition to the board, and we're happy to take questions.
All right, thank you. Senator Williams.
Thank you. Good morning.
Good morning.
I just wanted to say thanks for your willingness to continue to serve. We've had opportunities to engage, and I've been just very pleased with your approach and just things you care about. So I'm excited that you're continuing to serve on this board and for your expertise.
Thank you very much.
Senator Moon.
Hi, Dr. Hruza.
Good morning.
I had a question over the years, and it's come up, I guess, more prominently last year, and there's kind of a blurred line, pun intended there, I guess, with regard to whether or not the optometry area or the ophthalmology area should take the driver's seat, and it has to do with an ablation procedure. I don't want you to get too far in the weeds, and you don't have to tell me more than you want to, but what is your take on that? And I know we're all probably going to be recipients of some conversation and be involved in that. So what is your opinion?
Well, can you tell me specifically which ablation procedure?
I believe it's with regard to cataract.
Okay.
Yes.
So I think what you're referring to probably is something called a YAG capsulotomy, which is a procedure that about 25 to 30% of people need after cataract surgery, and it's a laser procedure where a film that has grown on the back capsule, which is the area that holds the implant lens, needs to be removed. So currently in the state of Missouri, optometrists don't have privileges. It's a laser procedure that's literally laser surgery. In certain states, optometrists do have that. So it's definitely a battle between optometry and ophthalmology. I think the the approach that I take is unique, possibly to the board, because I've pretty much only in my professional career worked in ophthalmology, so I work with people who do that procedure. It doesn't mean that I might not be inclined to want to do it. I personally don't, which some of my colleagues might find very offensive, but I like being a mom, and I'm soon going to be a grandma, so I don't want to be lasering people. I want to be an optometrist and go home. But it's definitely a scope of practice thing that is a hot topic in all of the U.S. and currently in Missouri as well. So I personally don't have a huge desire to be anything other than what I am as an optometrist. I have colleagues who would greatly disagree with me and not like that that's my opinion, but I want that if that's what they want, that's great for the profession. So I'm not. I like what I do. I tell patients all the time, I can do anything but operate on you, and I love that. So.
Well, it's good to hear another side of the conversation. I'm grateful to you for your honesty there. Thank you.
Thank you. Thank you so much.
Anyone else? Thank you for your willingness to serve.
Thank you very much, everyone.
Next up is Lori Boyken, also for the State Board of Optometry.
Yeah, nice to meet you too. So it's my honor to introduce all of you, or reintroduce you to Lori Boyken. She is also willing to serve as a volunteer on the State Board of Optometry. When I first got her resume, I was a little bit perplexed because I didn't see any of the typical professional qualifications, and then luckily the governor's staff clarified and will clarified that there is a public slot on the State Board of Optometry. So that's something that Lori's interested in. That responsibility is kind of an interesting slot, in my opinion, because it could go many, many different directions. But I will say one of the things that impressed me with Lori's resume is she has extensive experience in dealing with the public and taking public input and that kind of thing, since she used to work for a former congressman. And I have great respect for people that are dealing with constituent services, and I think that that means that she'll be responsive and a good listener and open to feedback from our constituents. So with that, we're happy to take questions.
All right. Anyone have Senator Moon?
Hey again, Lori.
Good morning.
Thanks for stopping by this morning. I was intrigued by your resume, particularly in the installation of political signs. And so I thought maybe we could talk afterward about that. But you're not doing that anymore, I'm sure.
I am not.
Yeah, but you had an interesting personal testimony. Would you think this is an appropriate time to talk to us about that?
Sure, absolutely. I have a family history. Eyes are passionate to me. Sight is very important. My entire family on my mom's side have tremendous eye issues. They have dry AMD. They have glaucoma. My mother had glaucoma, dry, one wet eye, one dry, took injections. I unfortunately, 3 years ago, saw Dr. Luetkemeyer here in Jeff City and was diagnosed with dry AMD. Last year, went to see an optometrist and looked at the screen, saw the little humps over my eyes and went, that's not good. Sent me to an ophthalmologist. Saw about 5 different ophthalmologists back and forth. They go, you have profound fluid all over your retina and your macular. We do not know why you see. So they sent me to a retinal specialist. That retinal specialist said, you have wet AMD. We will give you an injection. So I took an injection in my left eye, went back a month later. He said, it didn't work. So they ran me through more tests. I do not have wet AMD. They do not know what is causing the fluid over my eyes. I have been told, I go back to the retinal specialist every 2 months. It is still there. I've been told, please go live your life. We do not know. You could wake up the next day blind. So for me, I'm very passionate. I get very emotional about it. To have your sight at 59 and have it possibly taken away is scary. So, for me, it's all about your eyesight and your health. I do everything I can to promote health. I do it all, so that's why I'm here. That's why I'm passionate on the public side to bring more importance to your vision. So that's why I'm here. Great. Thank you.
Anyone else have a question? Well, that's kind of scary.
Yeah. It's unique. When you're told you're unique, I don't want to be unique
Yes,
at this
exactly.
age.
In that
young,
case,
you want to be unique, right?
All right, well, we wish you well, and
Thank
we
you.
appreciate you being willing to serve.
Thank you for your questions.
Yeah.
Thank you for your time.
Thanks for sharing.
Next up, Doug Krtek, appointed to Missouri Health Facilities Review Committee. Senator Luetkemeyer.
Madam Chair, members of the committee, for the record, Senator Tony Luetkemeyer here representing the 34th Senatorial District, introducing today one of my constituents, Doug Krtek, who has been nominated for appointment to the Health Facilities Review Committee. Mr. Krtek is the founder and president of Krtek Real Estate, which he established in early 2020. Prior to founding that firm, he built a real estate career spanning more than 4 decades, beginning in 1980. In addition to his professional work, Mr. Krtek brings significant public service and community leadership experience. He has served as a commissioner on the Parkville Planning and Zoning Commission, as a member of the executive committee and board member and membership chair for the Northland Regional Chamber of Commerce, and has also served and currently serves on numerous other boards and associations in our community. Mr. Krtek's background, leadership, and commitment to public service would make him a valuable addition to the Health Facilities Review Committee. And on a personal note, Doug is also a neighbor of mine. So I'm honored to support his nomination, and with that, we would be happy to answer any questions.
So have you met Jack, the baby?
I have not, but I'm well equipped or
You're good
acquainted
with
with
babies.
Truman.
Okay. Oh, okay. Well, that's the first baby.
That's right.
All right. Does anyone have any questions? Senator Beck.
Well, I have two things. We have two things in common. One, we serve in a committee. I think you've been on it for 2 months now, and there's a little bit to learn there. But you've been doing a great job there. And the other thing we have in common is there's probably only 8 people that are under the age of 55 that are named Doug. So I always know where everybody stands, and we're in that other age. We look down and we see that name is gone.
Goes with Karen and Susan, I think.
Yeah, but Doug is definitely not a popular name anymore. So I've been happy to serve with you on that committee. So
thank you.
Senator Moon.
Morning again.
Good morning.
We had a good conversation. I'm glad that we got to talk before this time here because it allowed me to get a little insight on what your thinking process is. And I've made you aware of the fact that I'm not favorable of the committee that you're going to serve on, particularly because I think it stifles competition. But you had some conversations with a CEO, I think it was, of a hospital that had probably a different perspective. It sort of divided the lines that I've been looking at. Would you like to share that conversation? It had to do with the equipment and the bed capacities and things of that sort.
Sure, I'd be happy to do that. In our conversations with Jeff Beck from your office on Fridays, I was made aware of Senate Bill 1268, which I think was a bill sponsored by you, and so I made some inquiries, primarily to the hospital executives in the local area. And as we discussed, I think as far as replacing property or replacing current things there, they thought certificate of need not being needed was probably not a bad thing. As far as increasing capacity, if it was more than 10 or 15% for a hospital at least, that they probably felt that was a good thing to come before a board like that. And I know at least in 1268, it doesn't affect the nursing home situation, and we discussed that a little bit.
And with regard to the equipment particularly, there are some situations, I'm not sure if they're the majority, but at least some, where the equipment is no longer maintained, and so it's obsolete, and they have to replace it, but yet they still have to come before the committee to get permission to purchase new equipment. So that'd be one area at least we could start with, I think, to say if that's the case, no need for approval, just replace it, because it's a business decision, and especially in the health community where you're having long wait times to see a practitioner, it doesn't make sense to add another hurdle for them to potentially move that wait time or extend it even further. So maybe that's a start where we can come to some agreement there. But I'm glad that you want to serve on it, and I appreciate your input and willingness to talk to me today about it, and wish you well.
Thank you, Senator.
Any other questions or comments? Seeing none, thank you for being willing to serve.
Thank you.
Next up is Cameron Christoffer. I'm sponsoring him, so. Mr. Chairman and members of the committee, this is Cameron Christoffer. He lives like 5 miles from my house, so I've known him forever. He's a 2007 graduate of North Shelby High School. He received his cosmetology license in 2009 from the Heart Career Center in Mexico, Missouri. He also received his instructor license in 2011, then his crossover license in 2020, all from the Heart Career Center. He is very passionate about the field of cosmetology and enjoys continuing his education with classes and attending hair shows. A lot of our members wouldn't need that, but Cameron has owned his own salon and boutique for many years. He has subbed at Mexico School of Cosmetology while working behind the chair over the years. He was an instructor for the Advanced Beauty College in Hannibal. He has helped with the National Interstate Council of Cosmetology as an SME over the years. Then he was approached about applying for the cosmetology instructor position at Heart Career Center, where he had always wanted to teach. He's in his 4th year of teaching there, teaching cosmetology and the crossover programs, and he is a DESE mentor for new vocational cosmetology teachers. He lives in Shelbyville. He is a single father of 2 girls, Caitlin and Charlotte, 8 and 7 years old. He has served as a board member on the Arts Council for the last 5 years. He recently received a bachelor's in education and training from the University of Central Missouri in Warrensburg. He feels that as a licensed practitioner and a vocational instructor with his expertise and perspective, that would be an asset to ensuring rules are practical, fair, and relevant for those working in the field. Cameron is a great guy and obviously doesn't have enough to do. So I highly recommend him, and I thank you for being willing to listen today.
Any questions for the nominee, Senator Williams?
Thank you for your willingness to serve. Arguably has to be probably the best fade in Northeast Missouri, correct? So with that, you have my support.
Senator Mosley.
Hello. Hi. So there's been a debate on TikTok regarding stylists, licensed stylists. Do they or do they not have to wash the person's hair when they come for service?
Well, To me, that's the connection between the stylist and the client, and if you can give a great shampoo, that builds that relationship between the two. But some people will have someone come in and shampoo for them, which allows them time to do other services.
No, I mean, okay, let me explain a little further. They were saying that some stylists tell the client they should come there with their hair already washed.
Well, it just depends on the stylist. To me, I feel like if I can prep the hair first, that will give me the best opportunity to give them the best service.
So Missouri doesn't have that, because the person said that, well, I guess wherever they live, the law there is that they have to be the ones, the salon has to wash the hair. The person can't come in with the hair already washed. And
They can come in and have their hair washed already, if they want to. It's up to the client's choice. Some people opt out of that service, but for me, as a personal stylist, I prefer to wash it myself, so I have a clean canvas to work with.
Okay. All righty.
Any further questions for the nominee? Senator Bratton.
Thank you. So, in years and years, there's been a debate on whether or not people who are cutting hair need to be licensed. What's the reasoning behind? If you'd have been here a few years ago when I was in the House, somebody had a bill to actually eliminate licensure for cosmetology, and I have never seen such a spectacle of angry hairdressers with scissors as they walk through the halls. And so, but, and please enlighten us, like, what's the need? When I was in the Marine Corps, and even to this day, I still cut my boys' hair, or I did before they grew up. I cut my own hair. And so what is the reasoning? What's the rationale of the need for this big licensure for cutting hair?
My opinion on that is we need to be trained on proper infection control and how to protect our clients from anything that can happen. And so when we learn how to cut hair, we don't want someone coming at us with a straight razor to give us a shave that has no training in that. So like with the proper training in that, it protects the client and it protects the stylist. So like I'm a firm believer in having that training under our belt. It sets us up for success.
And last question, so I work in the trades, and like I walk around, and because I'm in the trades, I notice and I stare and I judge other people's work. Is that what you do with people's hair as they walk around? I'm just, you don't have to answer. Thank you.
Senator Williams had another question.
Thank you. Yeah, it was kind of piggybacking with the licensure side of things. So is there an issue in Missouri where there are stylists or barbers or health hair professionals that are practicing or seeing seeing customers without a license?
I believe there is a big issue in that, people being unlicensed performing those services, and they will eventually get caught because it'll be advertised, and then hopefully we can catch it. But yeah, it is an issue that we see.
Yeah, I was just curious about that. I mean, I've had the same barber for a long time, but I've always assumed that most of them that work at a barber shop would have to be licensed. Are there barber shops that you're hearing in the state that potentially have unlicensed individuals working?
Well, we are very limited on barber shops over home. I don't hear of that in my area, but I would assume that throughout the state there will be.
Yeah, and I'm assuming that in your capacity, that'll be a focus to try to ensure that that's not a thing,
yes.
Right? Thank you. I appreciate your time.
Any further questions for the nominee? Senator Mosley.
So how do you think Senator Bratton did on his haircut? Just kidding, don't answer.
Any further questions for the nominee? Obviously, I have none. Thank you for your willingness to serve.
I just want to thank everyone because I've tried to get Cameron on here for 7 years. And so here we are today, and he's a great stylist and he'll do a good job. So thank you.
Next up, and I think last, is Gretchen Shull, independent nominee to the State Board of Education. Senator Carter, whenever you're ready.
Thank you, members of the committee. I'm Senator Jill Carter, representing the 32nd District, and beside me is Dr. Gretchen Shull. She's from Webb City, and she's a board-certified endocrinologist practicing in Joplin, Missouri with Mercy. Dr. Shull completed her internal medicine residency and endocrine fellowship with the University of Kansas School of Medicine and her medical degree from the University of Missouri-Columbia. In 2016, she was recognized with the Physicians Award, Salute to Healthcare for the Joplin Business Journal. Dr. Shull also currently serves as the physician lead for the Endocrinology Specialty Council and as a medical director of the Diabetes Care for Mercy Ministry. With that, I give you my full support for Dr. Shull. It was great to visit with her previous to her being nominated, and we had a great conversation. Obviously, you all know, as my colleagues, I'm passionate about education. And so to be able to sit with her and visit about the future of education in Missouri was an important conversation for me, and I appreciated the conversation, and I think she'll do a great job. So thank you. If there's any questions?
Thank you. Senator Williams.
Good morning. Thank you for your willingness to serve.
Thank you.
So kind of tell us why you're interested and some things you're passionate about. You know, the
Sure.
State Board of Education is in my opinion, moving forward, is going to be a very difficult board to navigate because of the challenges statewide with education. So I'd love to just hear your reason why you're interested.
Yeah, so I have a lot of different reasons. I think one, just kind of very high level, is that there is a connection to medicine, and I do a lot of chronic disease management. Interestingly enough, there's a big parallelism to how you get a patient where they need to go in the professionalism of a physician and their team, and then what that looks like supporting a student and where you get them to be proactive in their next chapter with the team of the professionalism of the teacher and that whole crew. The other thing specific to my journey, my personal journey, I was a graduate of a public Missouri school. I've been a lifelong Missourian, as well as my husband. We have 2 children. My oldest son struggles with dyslexia, did struggle with dyslexia. So he has a journey where we really had some roadblocks and had some understanding of what his needs were. So kind of to jump onto the next little sub-piece of your question is that literacy is a big, huge concern of mine. I think every kid everywhere needs to learn how to read. I've spent a lot of time understanding the concepts of that, the science of reading. I'm still learning about many of those pieces, how we get that in every school for every child, no matter what. So that's, I could go on and on, as you can tell. So it's just kind of where my passion started.
Yeah, thank you for that. You know, the State Board of Education, so I've spent quite a bit of time with members on the board. I pay close attention to it simply because of the simple fact that I represent a region that has 11 school districts just within my Senate district. Some of the top performing schools like Ladue, but also some of the more challenged ones like Riverview Gardens. So I've seen a very unique scope of education and how it's applied and how leadership goes about maintaining teachers, enrollment, attendance, and all of those things before you even talk about the challenges outside of the school building. What are some things that you believe or are willing to do to kind of ensure as a state board director that you're responsible for really finding solutions for school districts that may not be monolithic to the schools that you attended? What are some thoughts that you have about that, and maybe even from your experience on the board, what are some things you've seen that you believe could help address some of those concerns?
Well, I think one of the biggest things is that, as you know, I'm really new, so I'm learning about each individual school district, and I like the fact that you say every school district is very different. That's one of the biggest learning curves, I think, is that knowing that no two schools are alike in what their dynamic is like, what the children who attend those schools are, and then the parents and how they are. So it's different. You have to learn about each school district. My second board meeting, we were actually in St. Louis, Springfield, learning about that particular district, which is the largest in the state. And at that time, I didn't personally because I was so new, but our board had invited some St. Louis members to come and kind of start to get to know us and kind of talk about ideas and next steps. I do think communication and learning about those school systems is important. So just highest level, I think getting to know. I did not come from those school districts, but it's absolutely my job to get to know them.
No, thank you for that. And one last question. We've seen, and again, it's not even from a political standpoint, it's more from a perspective of whether or not you understand the scope of education and what it should look like tomorrow. We've seen that there's been unique approaches from school boards. I mean, let's just talk about Springfield, for example. I went down to Springfield a couple years ago, and I was very impressed with Dr. Lathan and the things that she's doing.
Yes.
And I would even challenge, if you're ever in St. Louis, I'd love for you to meet Dr. Sharonica Harding at University City, who I think is a trailblazer in education space, and many others. My point is how do we ensure that the state board is providing support to superintendents? And we understand the role of school boards. However, they're not always mutually exclusive to what we need to do as a state to advance the future of quality education. What are your thoughts in terms of how do you provide additional support, but also put in my mind, in some capacity, the department to have uniform approaches to ensure that school districts aren't engaging around issues that exceed the scope of education, and most importantly, prioritizing the students first?
Yeah, again, kind of in this room, it's a little bit of a loaded question that we could go on for hours. I think there is a piece, an element of accountability there, but again, educating yourself and communicating. I hate to keep saying the same kind of line of answering, but I'm in the process personally of learning about what perhaps other states have done to where they've gone directly to those superintendents to see what the troubled areas are. And then finding out what they need. So again, it's not about me coming in with an agenda and knowing everything, but it's about going and gathering information when there is an issue to where we need solutions and those troubled schools that need more from us. So again, I know it's not exactly a specific objective answer, but it kind of keeps honestly coming back to that.
Yeah, I'll love to connect after this and keep in touch.
I would love that as well.
Thank you. Thank you.
Senator Mosley?
Hi.
Hey.
I also represent Riverview Gardens School District as well, that is provisionally accredited. So with that being said, you are willing to go to those school districts who are struggling to see how you can assist? Because I did go to an education conference over the interim, and where all the schools that were invited were highly high-performing schools. They didn't bring anyone that was from areas that schools didn't do as well. So what works for them doesn't work for a school that's struggling. You can't tell us, like for instance, attendance. The school's district said that they started putting things on their transcript, and the students were afraid that this is going to affect whether or not they get into college. Well, if you're in a district of students where they can't see themselves going to college, that's not going to work for that student. Especially if they see that their colleagues are their fellow students who graduate as valedictorian but don't get any scholarships. So it would be nice to see you go into those districts and learn the difference between those schools and the high-performing schools.
Yeah, I agree. Certainly, I'm very busy, but to hopefully ease you a little bit, in my physician career, I did have a vice presidency for diabetes care and chronic management, besides kind of the avenues of what's already on there. Part of that worked with the quality and safety team at Mercy. And so what we found out with our diabetes control numbers, there were some hot spots that were doing things well. There were some others that were not. Every city was different. So Fort Smith, Arkansas is not like our communities in St. Louis medically, not like Oklahoma City, certainly not like the Joplin region that I'm at. So we had to go into those communities. We had to talk to people all the way from the physicians, even some of the patients, and then we had to go down to the medical assistants. We had to get information from them to figure out what was going on, what their needs were, what their likes were. Maybe they were doing something appropriately, but it just wasn't getting the attention, and it had some positive feedback. So I think that's kind of maybe a similar approach, and I think from what I'm hearing, other board members are very willing to do that, especially since we've kind of been on the move recently.
Right.
So I look forward to that.
I had another question. I had another question, but listening to you anyway. But I did have something else, a third thing. I know the state school board wanted to implement free school lunch and breakfast for the students because there are those students who may not be poverty or it may not be the high, but those in the middle that still can't afford lunch. How do you feel about that?
So that's something that I'm willing to discuss. I'm not exactly sure the particulars of how that would work. As an endocrinologist, nutrition is huge for me. So in the background, I want all children to have the best nutrition available to them at all times. So overall, that topic is exciting to me, but it would have to be something that I would be willing to look at to see what the particulars are. So I wasn't a part of that discussion initially on how that would move forward exactly, but if it could.
I can't think of my other questions.
Senator Bratton.
Thank you. Thank you for coming up. So as the chair of education, this is a very important topic. I guess my first question is, what do you perceive the actual role of the State Board of Education to be?
So I think, we're given specific direction at evaluating the commissioner and working closely with them, or she for now, and looking at the performances of the schools moving forward and looking at the accreditation and all of that. So those are the two biggest pieces that are obviously put before us that we have to do. But clearly there are other steps that we put a stamp on to show under what particular potential legislative priorities are, what discussions, working closely with the other directives. I guess in the background, kind of looking forward at the evidence, the evidence-based science, if you will, of education, what's next, to kind of promote certain key ideas.
So I would say a lot of that also is oversight of DESE, which is in
Correct.
charge of the implementation of what we pass and those things. Well, I guess in a school terminology and a grading system, what kind of grade would you give DESE and their performance to how they're really enacting and being forthright and everything with the data and the implementation of what we've passed?
So that's a very loaded question for me right now because I'm so new.
Well, just as your initial, like you're stepping in the door and kind of what you're perceiving. And I'm not trying to, but then again, these are very important questions that we need to know where people really feel if the billions of dollars we're investing in a department, if they're really implementing exactly what they're supposed to be implementing and doing what they're supposed to be doing.
So I think there have been people put in new positions that are gearing up for the next steps. I feel like traditionally there's been a lot of work to do I feel like there's a lot of work to come. It is nowhere near where it needs to be. The discussions that have been had have been the right things to say, and we have, over the next month or two, I'll be looking for action.
Okay.
Let me put it that way.
No, I know, and I'm not trying to, this isn't an attack, but then again, you're kind of you're the one at the helm to be able to help us to do our job as well. Now, I know the release last year and the year before, it's around 1,800 employees within the department. Do you believe that that's pretty, for only just over 500 school districts statewide? Do you feel that that's like, do you think there's an equilibrium that's out of balance here with that many state employees that aren't directly in those actual school districts?
So I haven't had a chance to evaluate that. I tend to be someone who practices on the lean variety where efficiency is key. Yep. And your knowledge base helps you be efficient. So not having evaluated that, I don't know, but that would be my stance, the comment that I just said. Okay.
Well, I appreciate it, and again, I'm not trying to drill you or anything like that. That's not what my intent is. But I think these are positions that you're about to embark on this, to where it requires making difficult decisions, and we're entrusting that to you. So I appreciate you being willing to do this. Thank you.
Senator Beck.
Thank you. Thank you for your willingness to serve. So I have a question. I'm going to give you a little story first, because it's kind of, it shows and it shows in real time of what's happening. I'm close to an individual who is a teacher who applied in 2009 into a high school position, government/social studies, and at that time there was 290 other applicants for that one position. We fast forward to 2025, and I had a conversation with this individual because they were on the committee. Roughly the same position, social studies, high school, same school district. Actually, they're even paying better now and some other things. 2 people applied. So the concern I see there is, one, is the recruitment and the retention of our teachers, and that affects not only the public schools, but that affects the entire education. A lot of teachers that once they retire, they go into a private school or whatever, but that pool is shrinking, and there's probably a lot of reasons why. I see that as like the number one problem. That and the funding is the number one problem facing us going forward. And I personally have ideas of why it is. A lot of it is the villainization of teachers and things of that nature that have caused that to happen. But I guess do you see that as one of the biggest problems or the biggest roadblocks, or something for us to solve going forward?
Yeah, when I stepped into this after my first board meeting, that is one of the key priorities, is teacher retention. And so I know that had been worked on, and personally I see it. I understand what you're talking about. And again, part of the problem is the whole system, back to our conversations over here, is that no school district is exactly the same. You can't just say, here's more money, I bet you want to do it now. That's not going to fix it. And so the way our teachers are trained and certified is a big discussion, and that's something that I'm learning about for sure. Lots of moving parts there, but that's definitely a key concern.
Senator Mosley.
I remember my other question. And I'm glad that you're understanding that no school district is the same, because a lot of people think there's a cookie cutter way of fixing everything. But my question is, in the poverty areas, they have they're not able to do field trips with the students. And with you being a doctor, I know you understand that hands-on is very important, and being able to go on these field trips helps with education as well. I know when my mother was a school teacher, she did a lot of field trips with her students to bring to life what she was teaching them. For example, she took them to the courts to do mock trials and things like that. So, with that being said, how do you think you can? Because I know they say the funding, it's the funding, not being able to afford buses to take the students to on field trips. So I don't know how some school districts are able to and some are not, but how are you able to, or may not be able to answer that today, able to address that?
Yeah, I mean, as you were speaking, kind of an interesting idea came to mind. I think it was our second school board meeting around that time. There was lots of discussion about getting the community members involved. Certainly because we were in Springfield, that was a discussion. And I know we've had sidebar conversations about the St. Louis area, about how the community is what's going to be working to strengthen things. So if we can get those community leaders and relationships in the schools, then potentially there's an opportunity there for interesting little sidebars of discussions on funding, but then also opportunity to open a kid's eyes on what's actually out there that they can do, because they may just not know what's possible. And so you get one person one day that walks in and says, look, here's an idea. That kid all of a sudden has 10,000 options that they didn't know they had. And so that's one thing that just popped into my head during that question. I'm sure we could have millions of discussions to further that.
Senator Moon?
One of Senator Bratton's comments triggered a thought that I've had for some time. The last time I looked at the Blue Book to determine departments and all their personnel, and it seems to me that I recognized a duplication of services, and so that might be something you stick back in the back of your mind as you're evaluating what changes, if any, need to be made within DESE. Part of our conversation yesterday had to do with the proper role of government, and we have been reluctant in the legislature, I think, sometimes to give up some of the control that we say we give back to the locals. Already I've had conversations with school personnel, administrators, and school board members asking about whether or not we will relinquish the control on start dates. And I think you mentioned every school is different. And because of that, start dates are likely to be different as well. And what problems do you see, if any, if the legislature were to just leave it in the hands of the school districts to determine when the start dates are? Because I think we're going to have that conversation during this session, and whether or not we come to an agreement, I can't say. But what benefits or problems could arise if we left the start dates in the hands of the school districts?
So, I mean, so this came up yesterday as kind of a new question that I didn't even really think about, but just because there is a firm rule on how many days before Labor Day school can start, and so now because Labor Day, this was our discussion yesterday, so as you know, Labor Day's later this year, so that's really going to put a bind on the calendars, and the schools didn't see that. I guess from what I learned, the initial reason for that had to do with tourism and state fair and things like that. So then that became a conversation of like, well, why does it matter for every school? So I think, yeah, all the board members, from what I could tell in the meeting yesterday, were willing to find ways or wanting to have that discussion of like, yeah, let's be flexible on that. It doesn't make sense. I guess my issue is just, I don't know what the problems would be with that immediately. I mean, it just kind of boils down to, you've got to find that happy medium of letting teachers teach, letting schools know what their community needs, but having the accountability that comes back. And so, I don't know, I'd have to get creative on what the school calendar would have to do. You know, it would be free days or testing days or prepping for the next step for the seniors. You know, I don't know, I'd have to get kind of creative and think about what the problems would be at that point. But
yeah, and that's a topic we could talk a long time. I don't want to create just fluff time,
right?
Because you know, it's what they learn, not the time they actually spend in the seat. And a lot of that can be learned outside too. There's lots of different ways to learn. But one of the things I'd like to put in your mind too for future references, we have two school systems in Christian County that I think are models for the state, and anybody who I can talk to get down there to see it, I'd like for you to see if you, or maybe invite the board as a whole to go down and see what's happening in Christian County. Whether it would be duplicated, I doubt, but maybe could be some ideas that could be learned from them, and maybe some different programs implemented that would be beneficial to all concerned. So thanks for your time yesterday, and I wish you well.
Thank you. Any questions?
Any other questions? Seeing none, thank you for your willingness to serve. Thank you for being here today.
All right. Thank you.
This concludes our hearing, and I make a motion for us to enter executive session. Do I have a second? All those in favor? All opposed? We're now in executive session. I now move that we roll all 10 nominees and 9 reappointments into one slate. Do I have a second? Is there any discussion on this motion? Seeing no more discussion, all those in favor say aye. Opposed, same sign. We now have a slate before us. I would move that we do pass the slate out of committee. Do I have a second? Is there any discussion on that motion? Seeing no more discussion, Mr. Secretary, call the roll.
Senators O'Laughlin.
Aye.
Luetkemeyer. Bean. Beck. Bratton. Brown. Berger. Moon. Mosley. Roberts. Williams. 10-0.
By a vote of 10-0, we have moved to pass the slate. I make a motion that we adjourn. All those in favor? All opposed? We are adjourned.